Hello guys, this is Dr. Possibility from Excel Academy. Kindly make sure that you subscribe to our YouTube channel and also make sure that you register with Excel Academy. In this video, I'm just going to explain my part 5 of histology revision. Please make sure that you watch part 1 to part 4. So let's quickly get started. So if we look at our first slide, we have been asked to name the slide. So the name of this slide is just a compact bone. So this is just a compact bone. The reason why we are saying that it's a compact bone is because of the presence of the Hervatian system. So this whole thing is just the Hervatian system. And this Hervatian system, if you observe, it has the Hervatian canal which is there. The other thing that can help you to notice that this is the compact bone is also due to the presence of the cells which are in here, which are the osteocyte, and these osteocyte are in the lacuna. So let's quickly go to 2. 2 is saying label the parts with yellow and red. So if you look at yellow, yellow is simply the nucleus of the osteocyte. So this is just the nucleus of the osteocyte. So this is just the nucleus of the osteocyte. And then when you look at red, red is simply pointing on the Hervatian canal. Red is just pointing on the Hervatian canal. Okay, let's quickly move on and look at the next question. The next slide we have been given, which is likely to be the slide of the spleen. So let's quickly look at the questions which we have been given. The first question is label the part marked with yellow arrow. So you look at the part marked with the yellow arrow, this is just the white pump. So this is just the white pump. Okay, so the white pump of the spleen, All right. So if we look at the next question, is saying states the content of the part marked red with the red arrow. So one of the content of this part are the splenic sinusoid. One of the content of this part are just the splenic sinusoids. Okay, and then you can also talk about the connective tissue, which is also there, and this connective tissue is known as the cord of Billroth. So you need to understand that the connective tissue, which is known as the cord of Billroth. So that's Billroth. All right, so those are just some of the content of the part marked with red. Remember, this part is just known as the red pump, and then this part, that part are just the white pump. Okay, let's quickly move on and look at the next question. So we have been given this slide, and the question is identify the slide. So if you look at this slide, it's having some muscles, some striation of the skeletal muscle, and also you can look at the connective tissue around the muscle fibers. So in that case, this is likely to be the tongue. So this is just the tongue. Okay, and then the next question is saying give 2 reasons for your answer. So the first reason we can give presence of striation of skeletal muscle. Presence of striation of skeletal muscles. So you need to take note that the tongue has some skeletal muscles, and then these skeletal muscles are being surrounded by the connective tissue. Okay, so you can talk of that, and then you can talk of some blood capillaries which have been surrounded by the pericyte. So you can talk about the blood capillaries capillaries. Okay, blood capillaries surrounded by the cells called the pericyte. Blood capillaries surrounded by the cells called the pericyte. The cells called the pericyte. Okay, called the pericyte. So the pericytes are just playing a role in the what? In the supporting of the blood capillaries. Okay, let's quickly move on and look at this slide. So we have been asked to identify this slide. So this slide is the skin, specifically the subcutaneous tissue. So this is just the subcutaneous tissue, the layer of the skin. So the subcutaneous tissue. As you have noticed, there are some squamous cells on top there. Most likely, if this slide is viewed on top, you can also see some keratin. Label the part shown by the arrows. So these arrows are just pointing at these parts and that part. So these are just blood vessels. So these are just blood vessels. Okay. So please take note of the type of connective tissue which is existing in the subcutaneous part of the skin, and you can look at this is just what the dense irregular connective tissue, the dense irregular connective tissue, yeah, which is just there. Okay, let's quickly move on and look at the next slide. The next slide, our question is identify the slide. So if you look at this slide is a very easy slide to identify, and this is just the trachea. Then you have been give two reasons for your answer. There are so many reasons you can give. You can talk about the epithelium here, this epithelium, though you can't really see it, but this type of epithelium, it is just the pseudo stratified columnar ciliated epithelium. So the presence of the pseudo stratified columnar epithelium with cilia. Okay, epithelium with cilia, which we can just say ciliated. Okay, and then the other part you can also talk about is the presence of hyaline cartridge. So the hyaline cartridge is the major component which makes up the respiratory tract, and specifically you can also give an example of the trachea. Okay, let's quickly move on and look at our next slide. So the next slide is identify the slide. So if you look at the slide, this slide is showing something which has a lot of neural bodies and a lot of fibers. So in this case, this is just a sensory ganglion. So sensory ganglion, okay, this is just a sensory ganglion, okay. Or you can also write the trigeminal ganglion. I think this slide, we did it in one of our revision classes, so please make sure that you watch the other parts. Then give two reasons for your answer. One, when you talk of this trigeminal ganglion, you can see the cytoplasm having the dark spot, which are just known as the nuclear substance, the nuclear substance. So presence, you can talk of the presence of the nuclear substance. So you can talk of the nuclear substance, which is just in the cytoplasm of the cell. Okay, Then the other thing you can talk about is the pseudo-unipolar cells, unipolar cells, and these cells are surrounded by what? Are surrounded by the satellite, cells. So there are some small cells that you can see, the dark stained cells like this one here, which are just what? The satellite cells. So these satellite cells, their major function is just to support the nerve bodies. Okay, the next thing we can look at is our part 6 of our histology lab revision. So make sure that you subscribe to our YouTube channel so that you can have access to our part 6 of histology revision. Thank you very much, guys. I really appreciate for the support. So please make sure that you subscribe to this YouTube channel, and also make sure that you contact me in case you need some help. Thank you very much, guys. Have a blessed day.